Let's continue with the next presentation, Power. Can you see my screen?
Yes.
Okay. So I'll be the one presenting Empower. I'm the coordinator of Empower. I'm a psychologist and I have also a PhD in psychology. I've been working since 2010 in Parc Sanitari Sant Joan de Déu. It's a hospital. Well, it offers psychiatric services, and there is also a general hospital. We are located in Sant Boi de Llobregat, which is a city near Barcelona in Spain. And Empower is the European platform to promote well-being and health in the workplace. And this is an European Union's funded project. Very briefly, Empower is an international research and innovation effort. And the main objective is to develop and implement a novel and low-cost e-health platform to address mental health in the workplace from a multimodal perspective. Can you see my screen if yeah?
Yes, we can see your screen.
Okay. So in Empower, we have 13 partners. We have 2 partners from Italy, ADAPT and Istituto Neurologico Carlo Vesta. We have also from the Netherlands, the Erasmus School of Health Policy and Management. From the UK, we have the University of York. In Spain, there are 3 partners, the Autonomous University of Madrid, OMADA, which is the technological partner in Empower, and then Fundació Sant Joan de Déu, which is the coordinator of the project. From Finland, we have City of Turku. In Switzerland, we have the Swiss Paraplegic Research. Then we have also Australian partner, the Australian National University. In Poland, we have 2 partners. We have the Nofer Institute of Occupational Medicine and the University of Lodz. And finally, we have also the Vrije University of Brussels from Belgium. And here you can see a picture of us. This was taken in February 2020, just before the pandemic. And this was the kickoff meeting. So we were very lucky because we could meet face to face. Why mental health in the workplace matters? Well, as you know, healthy workplaces promote mental health and well-being. First of all, a healthy workplace provides a positive return on investment. There are some studies showing that, for example, every dollar spent on promoting and creating this mentally healthy workplace can result in a positive return of $2.3. Also, those employees who are mentally healthy, they are also more motivated, they are more engaged in their activities, and of course, there is also an increase in their productivity. There is also a positive social impact in the sense that we can increase the quality of life of employees. This can also have a positive impact on their families and in society in general. And a mentally healthy workplace also makes legal sense. Both employers and employees have also these formal rights and responsibilities under anti-discrimination, privacy, and work health and safety legislation. So with all this, we created Empower. The main objectives of Empower, the first one is to develop in collaboration with the stakeholders. So we followed a co-design process, a multimodal and integrative online platform to promote mental health in the workplace and to reduce common mental disorders like stress, anxiety, insomnia, and depression. The second objective is to implement this online platform in SMEs and public agencies from 4 European countries. Why SMEs? Well, SMEs are the majority of enterprises in Europe. However, they have a very limited resources to be devoted to health in general and to mental health in particular. The implementation of this online platform will be done in Spain, Finland, Poland, and UK, because they represent different cultural settings and also different economical and health systems. The third objective is to evaluate whether this platform is effective, is cost effective. We want to analyze also the cost benefit and the potential social impact that this platform may have. Detecting and evaluating which are the factors that can influence on a favorable uptake. The fourth objective of Empower is to adapt all these to the European Union and national directives and legal and ethical requirements. And finally, we want also to see which are the most effective implementation strategies so that we can have a successful uptake of this kind of platform, and together with consultations with the stakeholders. Oh, sorry. This is the work package structure. As you can see, we have 8 work packages in Empower. The first one was the design of this e-health platform, and this was led by University of York. Then we have work package 2, which is the development of these online and e-health tools and the pre-pilot study. Then we have work package 3, which is conducting these field trials in SMEs and public agencies in 4 countries, Spain, Finland, Poland, and UK. And this is led by Fundació Sant. Then we have work package 4, which is the qualitative and quantitative assessment of the Empower platform, led by the Erasmus University of Rotterdam. And then we have the rest of work packages are, as you can see, cross-sectional. And we have work package 5, led by the Autonomous University of Madrid, which is the dissemination and communication activities. We have work package 6, which is the stakeholders involvement, uptake, and policy recommendations. Then we have work package 7, security and legal and ethical aspects, led by Fundació Adapt. And finally, we have the work package 8, which is the coordination and management, led by Fundació Sant. This is a timeline of an overview of the timeline. As you can see, we are now ending the 2nd year in 2021. Some of the tasks that have already finished are, for example, the design of the intervention. This is finished. The development of the app and the pre-pilot study is almost finished as well. And we are now going to start with the field trials in Finland, Poland, Spain, and the UK. And then we will continue with the quantitative and qualitative analysis. During all the years, during the 4 years of the project, we have also the dissemination communication activities. We have the stakeholder involvement and policy recommendations. We have also these activities to ensure that we are following all the security, legal, and ethical aspects. And finally, the coordination activities. So I'd like to also explain a bit the activities conducted in work package 1, the design of the e-health platform. So very briefly, what we did was first we conducted a scoping review to see which are the more effective interventions that already exist and how we can use them or not in our platform. Then, since we are going to conduct this in 4 different countries, we followed a specific methodology to translate all the materials and to make all the cultural adaptation in Finland, Poland, Spain, and UK. And we also conducted several focus groups, consultations with the stakeholders during this process because we wanted to be sure that we had the usability was high, to see whether we had to change some of the contents, etc. These focus groups were conducted with representatives from unions, from employers, from physicians, from also researchers. And with all this feedback, we adapted some of the contents. Just to mention also that this online platform relies on these three types of interventions. The first one is the universal intervention or promotion of mental health. In this, for example, we have material, psychoeducational material, we have an anti-stigma campaign, we have also an awareness campaign about mental health in the workplace from an individual perspective and also from an organizational perspective. Then we have the secondary intervention, and here the platform contains an assessment of symptomatology. The employees will get this feedback about their mental health, and we offer also different tools so that they can also improve their mental health, reduce stress, reduce insomnia, reduce depressive and anxiety symptoms. And then finally, we have this tertiary intervention because for those people who are on sick leave or they have frequent absenteeism or presenteeism, we have a specific module to help them to work with this symptomatology or to get back to work and help them to deal with all this symptomatology. So this is the final design of the intervention, of empowered intervention. As you can see, we have like these two online tools. We have the website and we have a mobile application. The website is public available and contains material to increase awareness about mental health in the workplace. It also contains psychoeducational material on psychosocial risk problems in the workplace. And employees can have access to this from the website. Then the mobile application that can be used in their mobile phones contains, first of all, a triage. And this contains the assessment of symptomatology and work functioning and the assessment of psychosocial risk factors. According to this, then employees will have access to different contents. One content is about promoting well-being and mental health in the workplace. And in this module, they have psychoeducational material about depression, insomnia, stress. They have also access to different tools to help them to reduce stress and symptomatology. For example, we have a tool to activate them, to promote the behavioral and physical activation. We have a tool for cognitive restructuration. We have also a tool of tracking emotions and feelings every day. We have a specific tool for problem solving. And finally, we have also a tool to promote the sleeping habits. Then there is also a module which is also tailored according to their answers in this triage. And this module is to improve work functioning and to reduce presenteeism and absenteeism. In this module, the employees will have access to techniques to improve work functioning. They have also a tool for problem solving and psychoeducation materials, a module to help reduce frequent sickness absence. And finally, there is also a tool to help them to establish goal settings. With all this, in the triage, there is also a questionnaire about psychosocial risk factors in the workplace and the stress associated with these psychosocial risk factors. And each employee will get feedback of the scores and also specific recommendations for these psychosocial risk factors. Then the employer from their company, they will get also an anonymous report on the scores obtained from all the employees from their company, and we offer them also specific recommendations for these psychosocial risk factors that are present in their company. Work Package 2, which is the development of the eHealth platform and pre-pilot study. We followed a 4-step user-centered design process. So, of course, as you can imagine, this platform will be implemented in very different kind of companies, because we have SMEs, we have public agencies, we will have also participants who are blue-collar workers, white-collar workers. So to create the app and the look and feel, we follow this user-centered design. So we created several user personas profiles, for example, according to the country and according to the gender and according to whether they were blue collar or white collars. And then we created this look and feel of the app. The first thing that we created was a prototype, which is a beta version of the app. And we, the Omada, which is the technical partner of Empower, they follow this technical architecture, which is we have a front end. In this front end, we have the app and different tools. Then we have also a back end in which we are going to save all the data collected. And also we will have, employers will have access to this backend. And finally, we have the front end of the website. Before launching the app, we conducted several pre-testing with users, with external users. First, we conducted this guided visual testing with selected users. Then we tested the beta version, the first beta version. And once we had the app, we asked feedback to these users with the first version of the app. And then there was also a third iteration with an improved version of the app. And now we are in the last phase of this pre-testing in the fourth iteration. And basically, we are now testing whether, the last version of the app, which contains gamification, rating, contacts, and other characteristics. And the final step is the release of the app. So here you can see how it looked like, the app, how looks like. This is also the anti-stigma campaign, which is public available. As you can see, there are different materials. For example, we have material about what a healthy workplace means, or what is mental health, or why it's important to take care of your own mental health, how you can help other workers, how to start a conversation with a workmate, for example. There is also psychoeducational materials about risk factors in the workplace, and so on. So Work Package 3 is field trials in Finland, Poland, Spain, and the UK. The design of this control trial is a step-weight cluster randomized trial. This means that we are going to randomize different clusters. Each cluster represents a company or a department, and we are going to randomize them into these three main groups, Group A, B, and C. So that means that all of them will, all the employees from these companies will have access to the content of the app. They will be able to use the app for at least 7 weeks. But the difference is when they will be able to do so. Some of them will start at the beginning of the study, and some of them will start later. And in this design, as you can see, we have 5 different time points in which we are going to ask them to fill different questionnaires through the app. The recruitment, we are finishing the recruitment in these 4 countries: Spain, Finland, Poland, and the UK. So far, we have different companies, 5 public agencies, 6 SMEs, and 1 big company. And this represents more than 15,500 employees. Of course, we are finding some challenges, like, for example, of course, because of the COVID-19, some of the SMEs, they don't have, or they don't feel that they have enough resources to devote to this kind of project. So we are having some problems in the recruitment of, especially of SMEs. We've created also several materials to recruit employees. Here you can see posters that we've created. These posters can be posted in the walls of the company, and we invite them to participate in this study. We explain why it's important to participate, who can participate, and of course, the website of the Empower project if they want more information. Work package 4, which is the quantitative and qualitative assessment. Very quickly, I would say that there is like these 3 main activities within this work package, led by Erasmus University of Rotterdam. We have the quantitative analysis. We are going to analyze effectiveness and cost effectiveness. Then we are going also to collect qualitative and data from employers and employees. To do so, we are going to conduct interviews, face-to-face interviews or online interviews during the control trial as well. And finally, we are going to conduct the impact analysis using this GAF analysis, and this will be done by our colleagues from the Australian National University. Here you can see an overview of the assessment protocol. This assessment protocol will be asked 5 times, just at the beginning of the control trial, and then in 4 more times follow-ups. We are going to ask about demographics, lifestyle, emotional health, including depression, anxiety, stress, insomnia, mental health, quality of life, well-being. We ask also about quality of life, diagnosis of mental disorders, chronic medical conditions, and somatic symptomatology. Then for the cost analysis, we need also to ask about productivity cost, work productivity. We included also a set of questions about the corona's impact on productivity, because we thought that this can be very useful due to the pandemic situation. We also ask about sick leave, absenteeism. And finally, we ask about medical health care, because we will use this information to calculate medical costs to conduct the cost-effective analysis. And finally, work package 6, I'd like to mention this work package 6, stakeholder involvement, uptake, and policy recommendations. So in this work package, for example, we've conducted a scoping review of intervention strategies, because we wanted to see which are the barriers for a successful implementation of this type of interventions. And with this, the outcomes of this scoping review, we are creating online consultations with international stakeholders, because we want to see whether there are more barriers that maybe we haven't detected in this scoping review. And with the results of these online consultations, we are going also to conduct some in-depth interviews with some of them to explore in more detail which are the barriers and facilitators of the uptake of this kind of interventions. So this is all. You can see here the contact information, our email address of Empower, the telephone. You can also see the website, Empower Project website. And we are also in different social networks like Twitter, Facebook, YouTube. Thank you so much for your attention. I don't know if there are questions.
Thank you, Beatriz. Yes, there's a couple of questions. We don't have a lot of time. There's a very interesting question from Jane Ball, but I think it would be better if we leave it for the panel discussion. Jane, if you don't mind, because it's very interesting, and I think that also Professor Luca Pentatoni can comment on that as well. So I'm going to give you a couple of short questions for now, so we can discuss this another 5 minutes, and then start with the following presentation. Lucia was wondering, what are the engagement strategies, materials you have been using to recruit companies, mostly SMEs?
Yeah, we've created, for example, for the SMEs, in Spain, for example, because we had some problems in recruiting them, so we asked an employer association in Baix Llobregat. Baix Llobregat is in an area in which our hospital is located, and there is an employer association. They had a lot of, well, hundreds of SMEs, and we asked them to collaborate with us in the recruitment, and they help us with the dissemination of the project. And for example, we organized also a webinar with these SMEs. We presented the project, and this was really helpful because after that we got a lot of SMEs, well, some of them. And then we created these posters. We created also like a newsletter, so that the employer can send around to the different employees. And some of the companies of these SMEs have also asked us to go in person to their company and explain the project to the employees. And I think this is also really helpful, especially for the for the blue collar employees, because sometimes they need to understand the project. You need to use a very plain language. You have also to mention the importance of mental health, and I think this was really helpful.
Thank you, Beatriz. Another question from Jane Ball: Are any of the public agencies SMEs recruited healthcare workplaces or employers?
There is one in the UK, the NHS, for example. They are going to participate in this control trial in the UK. And we have public agencies. We have also city councils. For example, we have the City Council of Sant. We have the City Council of City of Turku.
Thank you. And finally, because I think we don't have a lot of time, Julia Flintrop from OSHA was asking, is it very expensive? It's very expensive to create and especially to maintain apps. Are there any plans, resources available to maintain the application after the finalization of the project?
Yeah, thank you so much. Yeah, this is an important question. Actually, this is part also of the last year of the project. We want to see how to create this more or less business model to maintain the app. We have to calculate this cost actually, and this is part of the second phase of the project, but it's really important and is part of the activities that we are going to conduct at the end of the project for sure. Because this is a question also raised by the SMEs and the companies. They want to see how much this will cost, who is going to pay this.
Okay, thank you very much, Beatriz. I think we should continue with the next presentation. And as I mentioned in the panel discussion, there will be 20 minutes for questions and answers. So I'll note all the questions that we don't have time to answer now, and maybe we can discuss them later.
Thank you so much.